organ-specific amyloidosis. So the first one under organ-specific amyloidosis is Alzheimer's disease. And as we know, Alzheimer's disease is due to accumulation of beta amyloid protein. And this comes from our amyloid precursor protein. And remember, this amyloid precursor protein, the gene is located on chromosome 21. And that's why in patients who have Down syndrome, remember in Down syndrome patients, they have what? They have 3 of these chromosomes. So they have trisomy 21. And that's why those patients are going to be producing tons of this protein. And that's why they could develop early onset Alzheimer's. So in those patients, they could have early onset Alzheimer's disease in them. And this amyloid precursor protein, they are transmembrane glycoprotein, and they are found in the neurons, and you can also see them in the synapse and other tissue. And this a beta amyloid that comes from the amyloid precursor protein, they deposit in the brain. And when you do autopsy on patients who have Alzheimer's disease, you're going to see them as senior plaques in the brain. Moving on to the next organ-specific amyloidosis, which is type 2 diabetes mellitus. In type 2 diabetes mellitus, as we know, is due to insulin resistance. So there's insulin receptor resistance. And because of the insulin resistance, because of that, the beta cells is going to be making a lot of insulin. So that's why at the early stage of diabetes is usually what? Hyperinsulinemia state. So you're producing tons of insulin. And as you are producing the insulin, you're also releasing what? Amylin. So the amylin is also produced along with the insulin. And then guess what? This amylin could be deposited and be converted, misfolded, and be converted to amyloid. And that will deposit in the beta cell. And like we mentioned earlier, amyloid could trigger apoptosis. And then with time, that will lead to destruction of those beta cells. And then with the destruction of those beta cells, those patients will now develop insulin deficiency. So that's why patients who have type 2 diabetes, initially, they could be non-insulin dependent. And then later, in the course of their disease, then they could develop insulin-dependent diabetes mellitus because of the amyloid deposition. Moving on to the next one, which is medullary thyroid carcinoma. As we know, medullary thyroid carcinoma is a tumor that originates from the parafollicular C cells, and the parafollicular C cell produces calcitonin. And this calcitonin could be converted to amyloid, and they're going to deposit in the tumor stroma. And that's always a classic histology. So if you see someone who have a thyroid mass, they did a biopsy, and they did mention that they applied Congo red is positive, and they're concerned about amyloid deposition, always think of medullary thyroid carcinoma. Who can remind us which gene is associated with medullary thyroid carcinoma? Very good. Rett oncogene, very good. And as we know, Rett oncogene mutation is associated with MEN2A and MEN2B. Very good, guys. Moving on to the next one, which is isolated atrial amyloidosis. As we know, anytime you have increased pressure in the atrium or increase in volume, so either increased pressure or increased volume, anything that stretches the atrium will lead to production of atrial natriuretic peptide. And this peptide could be converted to amyloid, and that could deposit in the atrium.